which is the Second District Court of Appeals. The Second District Court of Appeals is the appellate court. Basically, if you think about its jurisdiction, it basically carries everything from Lakeland to St. Petersburg all the way down to Naples. So it really is a truly a once in a multi-generation opportunity to move the court. Historically has been located in Lakeland, and then that in a sick building in Lakeland, so they moved it to Tampa temporarily and housed it at Stetson. And now we've had the opportunity to really reevaluate where we want that court, and we were able to convince the legislature that St. Petersburg or Pinellas County was the right place. But we are really looking at the Mirror Lake property. We will explore other options too. I think we owe the taxpayers that, but the state already owns that piece of property. It is currently underutilized, and it's in an older building. So we really are excited about the opportunity to enhance that property and bring that forward. Another idea that's, or another piece in the budget that's currently in process of getting to the governor is a brand new high school for downtown for USF St. Petersburg. Or sorry, not for USF, for St. Pete College, the downtown campus. So one of the interesting things that's occurred to St. Pete College over the last few years is more and more online courses, which is freeing up classroom space. And so the real vision is to create a new high school, collegiate high school in downtown St. Petersburg, and then also one in Seminole. We'll get the appropriation for that next year, but the appropriation this year definitely covers the ability for us to put a collegiate high school in downtown St. Petersburg. So really excited about that opportunity as well. That would be located right there, kind of at the Williams Park St. Pete College downtown campus. So incredibly excited about those two opportunities. I wanted to get those out there. As it relates to COVID, look, we have seen an incredibly historic, challenging time. And look, even when we turn the lights back on for Florida businesses, it's going to take months to ramp up into getting people back into restaurants, back into hotels, and kind of back to normal. I would imagine it's going to take months and months to kind of turn all of these things back on. And then of course when you turn them back on, you have to get rebookings, and you have to get people get comfortable, go back out to restaurants and kind of back to normal life. So it's going to take time for us to adjust. Beyond that, I think the governor's probably going to have a kind of a walk, or a crawl, walk, run plan, and that will probably kick off hopefully this week. We'll make some announcements. I would anticipate those probably around Friday. Seems like he would make those announcements over the weekend or on a Friday, and then give time to ramp back up over the weekend. So I think that's what you could expect, but happy to answer questions as you have them. But we had a great year for St. Petersburg and Pinellas County in the budget this year as well.
Thank you so much, Senator. If there are any questions, direct to the chat. I guess I'll go ahead and kick off if that's all right, Madam Chair. But what is the timeline of the DCA?
So the timeline really is that the initial $21 million is allocated in the budget this year. Now that's not enough to build the District Court of Appeals. There's many judges. There's obviously support staff. They have their own sergeant's office. So they have their own really police force inside the DCA. So the initial construction dollars will start July 1 of this year. And so we have $21 million for this year, and then we'll follow back that on with a separate appropriation. But that $20 million is really used if we need to relocate the individuals that are currently in the building downtown, which is, as you know, catty corner to City Hall there. It allows for the funds to use to relocate those individuals so we can find new space for the agencies that are currently housed there. They'll still be located most likely in Pinellas County, so we're not losing those jobs. And then we would be able to do all the design, the engineering, scrape the property if necessary, or acquire new property if that one doesn't ultimately work for the court. But it will be in Pinellas County, subject to the appropriation going through.
Looks like we have a question from Janelle Irwin. Is that line item in jeopardy of being cut due to COVID?
I really don't think so. I mean, I think the governor is looking for these types of projects, partially because I think they see these as jobs opportunities. Going into those, the opportunity to kind of create jobs in the community right now is especially important. And this is something that has to be funded. It's not a question of whether it's, if it's this year or next year. The lease runs out in 2023. The court this is their number one priority for the state court system as a whole, is the building of the Second District Court of Appeals. And frankly, it's a historic opportunity that I worked hand in hand with Chris Sprouse, who's the Knicks speaker, over the summer, over the session on. So we're excited about the opportunity, but I would find it highly unlikely for him to veto this.
All right. Any concerns about the full funding of Sadowski being taken back due to COVID? That's from Councilwoman Brandi Gabbard.
Yeah, I don't think so. I mean, I don't think they're going to cut affordable housing at a time when you have so many people struggling with rent and foreclosures and all the other issues. I'm not a big fan of the Sadowski Trust Fund as it stands. Because I think it should truly be a voucher program or simply a block grant program to the counties, and let the counties kind of figure out what's best for their community, versus the state trying to figure out how many, tying all of these restrictions and rules to them that are heavily politicized and lobbied by the realtors and other organizations who say you can have to spend this much on new home purchases. Well, look, right now, right now it's keeping people in their rental apartments. And so maybe vouchers might be better now. But that's a discussion for another time. Right now you have the funds in Sadowski. They're gonna be distributed. I don't see Sadowski being cut. If anything that they're going to pull back on, I think they pull back on state worker salaries. There was a state worker salary increase. I don't see them touching teachers. I really don't see them touching Sadowski at a time when you have so much need in the community.
Great. Any other questions for Senator Brandes? Well, Senator, thank you so much for joining us tomorrow. I invite you to stay on if you can. I know that you're homeschooling all your kids right now, and along with your other duties.
By the homework behind me.
Going back to school for sure. We got one more question from Al Carnavicius. Employers and employees continue to struggle with access to the DEO website. What is being done? I know you kind of touched on that, but can you go a little bit deeper on when we think that's going to be back up?
The entire website is built in flight. We are building the plane as we go here. They've brought on additional servers. They're taking it down over the weekend to upgrade it. So this is, people talk about we're going to review the site in a year when we go back into session. I mean, it's going to be a completely different animal by that time. I mean, they're going to have this thing. They have to. I mean, there just is no excuse for how poorly it's operating right now. But no, we understand people are still struggling to get on. They're processing them as quickly as possible. They took paper applications a few months ago or last month, and so that has its own set of challenges as somebody has to kind of interpret the hieroglyphics of everybody's individual handwriting as they and put that into the computer, because that has to all be manually done. So there's this kind of lag between those. You've got obviously multiple systems now feeding into the overall system. So it's a real debacle, and it was just never designed. Not that we could really ever design it for 1.5 million people in the course of 6 weeks, but they have obviously got new management there now. They've taken away the management from the previous DEO director, and they've provided it to the Department of Management Services. So Secretary Satter is working on it right now, and I think the governor has essentially given him the run of the house in order to pull state employees. So they're pulling people from Department of Revenue. One of the challenges that you've got to have, because you're dealing with sensitive information, you have to have a higher level of state clearance and background checks in order to get that done. Because frankly, I offered my staff, as well as many other senators around the state, we said, look, our staffs are here, but they would be more efficient up there. Let us send you one or two of our staff members and let them work with you all every day to try to get more of these processed. But they've moved to people from the Department of Revenue over there, and they have thousands of people. But if you just do the math, it's you say one person can do 6 applications an hour, and then you scale it up, you begin to see how challenging it is. That, and they're running into some issues with the federal government system. Obviously, the federal government system is getting fed in from all the states. One of the differentiators from what I understand is, and I'm not supporting this idea, but the states that have state income tax, those individuals, and the reason that you're hearing those states getting processing quicker is because when you have a state income tax, you're getting all this information anyways, and you're verifying these individuals, and so many of these people are already verified in their systems, and that's something that obviously Florida doesn't have, and so why it's taking a little bit longer for us to verify them is because if you have a state income tax, the systems are generally designed to pre-clear these individuals, so that's why sometimes other states are having a quicker turnaround time than Florida is.
Excellent. We got just 2 more questions and then we'll move on. But Ryan Griffin, our board chair, asked, when would the SPC project go online?
Great question. So it's so the funds will be there for this year, so 2021. So we would imagine they could be up and running by next school year or the following, at least the following school year. But we really want to give them the opportunity to have a planning year and then implementation year. But I think given that they already run 2 of these collegiate high schools, and one at the Gibbs campus in St. Petersburg, and then the other one up in Tarpon Springs, that bringing a third online really isn't challenging for them. I think for us, it's really casting the vision for what we want this school to be. My vision and what I've explained to the president of St. Pete College is I really see it as kind of an arts and science focused collegiate high school. I think you can't put it in the middle of the greatest arts community in Florida and not really focus on the arts. And I think that's where we have a real great opportunity to just be a leader in the country, and frankly in the arts community, is to have a collegiate high school really focused on the great arts community of St. Petersburg.
Awesome. Then I guess last one that we'll go with is the state resiliency officer, that left at the beginning of the year. Do you know where they are on replacing her? Obviously, there's more pressing things with.
I haven't heard. They are so. I mean, look, they are so backed up with appointments, and we need to get a election supervisor in Pinellas County post haste. I mean, we have an election coming up, and we don't have an election supervisor right now. So we have one who's kind of staying on until they find a replacement. But we're really pressing for that to get done any day now, because that's the kind of most pressing issue right now for Pinellas. But as far as a state resiliency officer, I think you should wait until all of the COVID discussion really dies down before they're going to refocus on that issue and many of the others. Because I'm waiting on. I've had some of my nominations in for 6 months waiting, and I call weekly to try to get those unstuck or figure out where they are. And basically, what I'm told is everything's delayed until COVID's they stop focusing on COVID.
Awesome. Well, I will pass it back to our chair. Thank you so much, Senator. Really do appreciate it.
Yes, thank you so much, Senator. We're really all very interested in what you have to say, as well as some of our other speakers that are here today, our other attendees that are here. I also wanted to take this moment to thank our past chair, Bill Kent, for attending, and our present chair, Ryan Griffin. Thank you for joining us. Councilwoman Brandi Gabbard, I know you're here because you asked a question. Can you give us a report on what's going on in St. Pete?
Absolutely. Good morning, everyone. Thank you, Anne, for having me. And first, before I start, I just wanted to say thank you to Senator Brandes, not only for all of his hard work in Tallahassee, but for being here with us today to give us that exciting update. Those were projects that we had kind of talked about privately in Tallahassee, and I'm really glad to hear that they are moving forward and coming to fruition. That's great for our city. So the city of St. Pete, I've been on calls with several of you over the course of the last few weeks as council has ramped back up into having our meetings. Last week we had our CIP workshop for the 2021 budget. That is, prepared weeks and weeks in advance by staff to present to us as their proposed capital improvements for next year. So we went ahead and moved forward with the draft that was submitted to us, knowing that these next few months are really going to be critical in showing us what our revenues are going to be and how we can really shape up the 2021 budget. So there wasn't a lot of fireworks there, kind of the typical stuff, the seawalls, the, HVAC systems, stuff like that. But really, I think where it's going to come down to is how much money we actually have to move forward with. So draft has been done. There will be more proposals in the next coming months, and I'll keep you posted on that. Really, the conversation right now is really how we reopen and how we restart St. Pete. I wanted to, first of all, if you're not aware, I'm sure you are, draw attention to the Restart St. Pete Advisor Task Force that the mayor has put together. He announced that last Friday, and those individuals have already come together in one meeting. They had a meeting yesterday, and there was media on there. I'm sure there'll be reports coming out, but I do have a YouTube link to that entire call. I can actually share that with Matt if he'd like to share that with everyone. I wanted to thank Chris Steinocher and anybody else who's on here that is actually on that group. Very, very good cross-section of people that are going to be discussing really the intricacies of how we restart. On Thursday, City Council, starting at 8:30, will have a committee of the whole. And that is one of the topics that we'll be discussing that day, is this idea of restarting. I can assure you, and I believe that Commissioner Welch is going to be on the call, hopefully a little bit later, to share county information. And it will be much like how we went safer. Anybody who really understands the geography of St. Pete and Pinellas County realizes that with our geographic boundaries, it's really hard for us to do things individually. So it's important that we do have that kind of concerted effort together. I've had conversations with the mayor privately regarding, kind of what we're looking at is that 14-day positive cases. That's really what we're looking for. Pinellas County has fared really, really well, in consideration for what's going on across the state. Amber Golding, our emergency operations manager, yesterday reported that Pinellas County has only had about half of the percentage per capita of positive cases that even the rest of the state has seen. And I think that has a lot to do with decisions that were made. And I'm pretty confident that as we move forward, the mayor and county administrator, county commissioners, and council will be just as diligent in our response for how we move forward. Brandi mentioned it. The governor said yesterday, it's not going to be an overnight turn on until we have things like more testing, testing that gets faster results. I don't think we're going to be able to focus it completely on full blast. Yesterday we were encouraged to see that in conjunction with the Department of Health, there was a walkthrough and a drive-through testing site that was set up in Childs Park. Testing like that is very important. We know historically that, lesser served communities have always had problems with access to healthcare, access to primary care physicians, and access to what they need. So we're going to bring the testing to them. We have to ramp that up even more. Yesterday, I believe, I don't have the exact numbers, but I think I had heard that they were able to test about 150 people. And those tests take 7 to 14 days to come back. So I think even with those efforts, we could probably all agree that we need to do more. And so more testing, faster results, and I think we're going to have to get really serious about what a contact tracing program looks like in our community. That's one thing that medical professionals have really talked about being important for being able to go back to normal 100%. Not a medical professional by any means, so I have no idea what that would look like. But you know, those are the kind of conversations that we're going to be having in the coming weeks. So stay tuned. You know, there's just a couple of other issues of concern that people have brought forward to me that I'll be discussing hopefully with the mayor later on today, and then at our committee of the whole on Thursday. But, you know, we've got a lot of residents who have taken advantage of the fact that we were not turning off utility bills due to delinquencies. We're not doing any sort of, you know, late fees or anything like that. We are asking people to pay what they can, but if they cannot pay right now, we have kind of suspended that billing process for them. But my concern is, how do we help people get caught up? How do we help people be able to, you know, make whole and not have them a large bill that's due, you know, say 2 or 3 months from now when we are back to our new normal. So that's one of the things that hopefully we'll be able to get really a solid plan on. We also have about $1.5 million in additional HUD funding that was issued through the CARES Act. We're working on putting together a rental and mortgage assistance program with that money. You know, of course, you know, with anything that comes from the federal government, there are a lot of, you know, restrictions, a lot of guidance that, you know, we need clarity on how we can use that. But we are moving forward and trying to go ahead and set up a program, even if we have to front the money before we actually get the money to reimburse ourselves. So that's something that we'll be talking a lot more about. And then, you know, if we're going to be sending people back to work, how do we take care of childcare issues for them? We don't have school through the end of this academic year, and summer camps, especially like the city summer camp, was set to start on June 1st. We're still on track for that as of now. So, you know, what does that look like for people? Because that adds a lot of stress. I'm a mom of a young child myself. Senator Brandi was talking about homeschooling. It's something that adds a lot of stress for people. If they're required to go back to work, what do they do with their children? So these are just the kind of things that I'm particularly concerned about, and we'll be looking for more information on, but I would love to hear questions and kind of what the concerns are for everyone else, because this is really the time to try to get those answers when we meet on Thursday.
So thank you very much, Councilwoman.
That's really all I had.
Really do appreciate your time this morning. Looks like we have a couple questions. Not sure if this is in your wheelhouse or not, but from Brooks Wallington, our transportation chair. What have you heard about antibody testing in the Tampa Bay area? Are we expected to get that soon, or, you know, what's going on with that?
I have not heard about that. The link to the call yesterday, I was only able to listen to about half of that this morning, but and Chris may be able to talk about it because I know he was on there. I don't know that that's something that we have really talked about having access to yet, but I'll certainly add that to my list, because I know that's one of the tools in the toolbox that helps us be able to get back to, you know, full steam. So I'll add that to the list.
For sure. And from Janelle Irwin from Florida Politics, what's the word on the pier opening? It's supposed to be at the end of May. Will things be open? Will we not have the big celebration? What do you think?
Well, I can share with everyone that the pier is on track. I would say that they've probably been able to actually do more work right now than they thought they were going to be able to do. Once all of us that, you know, wanted to be nosy and go out and tour and see, you know, what was happening, we were doing several tours a day, and that was kind of, you know, being, you know, in the way, if you will, of some of that construction. So it's really ramped up. We are on track for it to be completed. Now, as far as our big celebration that we were hoping to have, no decision has been made as of yet.
Awesome.
It's still on the calendar. I think we hope that it will happen, but as of now, we're not 100%.
All right, and then can you just re-ask what the or retell us what the number was for that HUD? Was it 1.6 million?
It's a little over 1.5 million total. There is some emergency grant funding that is a little over 500,000. And then there is additional CDBG, Community Development Block Grant money that is a little over $1 million. So about 1.5 when it's rounded down.
I think our chair, Ann Pollock, has a question for you.
Yeah, I was just thinking about, we talk about June 1st, that's hurricane season. I wonder if that's in the back of your minds, if there's been discussions in the city about how to prepare. And I assume it's a county question as well, coordinating on preparation, emergency management, evacuation, given this. But I wondered what was going on.
Yeah, there has been a lot of conversation behind the scenes with our emergency management regarding this. I mean, it's certainly, this is the time when we do a lot of our hurricane preparedness conversations. We start to really get ready for that season. So yeah, I mean, there's definite concern if we would have a major storm and we have to shelter people. How do we do that and maintain safe distance? I don't think, anybody, just like we didn't have answers for how we deal with a pandemic, I certainly don't think we have answers for how we deal with a pandemic and a hurricane. So, I mean, we are looking at that. We're looking at, alternatives and how we can make sure that we keep people safe because, June 1st is right around the corner. For some people, that's a really exciting date. For those of us who have to do planning, it's really, summer is here, but we have more to plan for. So.
Thank you.
Any other questions for the Councilwoman? All right, well, thank you very much for joining us. I hope that you'll stick around. I don't believe we have Commissioner Ken Welch yet. I know that he had a policy group meeting this morning, and he was going to try and join us between that and then the County Commission meeting that starts at 9:30. So I'm on the lookout for him. But Ann, I'll go ahead and turn it back over to you, and we can move forward.
I understand that TBARTA Director David Green is here. David, would you be willing to share an update on where your agency is and what's going on there?
Good morning, everybody. Sorry I had to unmute there for a second. Yeah, glad to be on with you guys this morning and good to see so many familiar faces. The transit industry clearly is being impacted as much as any other industry that you all are involved in. COVID is impacting us in ways that we couldn't have imagined just a few months ago. I mean, obviously the economy is unrecognizable, and I'm sure we all know people whose jobs were affected and doing everything they can to stay healthy. But, the two greatest impacts to transit have really been in the areas of operations and funding. Operationally, agencies are emphasizing the safety of employees and passengers, and, they've adjusted accordingly. Where the industry traditionally focuses on, increasing frequencies and maximizing the number of vehicles that they have on the road and ridership and fare box return, now it's kind of the complete opposite. Some of the strategies that agencies have adopted, and I'm not talking about specifically local agencies, but, agencies across the country, they're reducing service levels. They've eliminated fares, they've implemented rear door boarding, and, they're limiting the number of passengers that can ride at a time and blocking off seats to spread passengers throughout vehicles as much as possible. Some agencies are actually encouraging people to not use transit unless they absolutely need to, if you can believe that. They're providing PPE to bus operators, and from a maintenance standpoint are focused on disinfecting vehicles as much as keeping them in good operating condition. On the funding side, Obviously there's lost revenue for those agencies that are not collecting fares, and there's a great concern about future funding streams from cities, counties, and states that obviously aren't collecting as much revenue as they budgeted. Fortunately, at the federal level, the CARES Act was signed into law, and it was a total of $2.2 trillion. $25 billion came to the transit industry. The intended use for those funds were to prevent, prepare for, and respond to COVID-19, to cover operating costs to maintain service, to cover the lost revenue that I mentioned, and to purchase PPE. But the FTA, once that program was implemented, they expanded the uses of those funds to actually include all activities that are normally eligible under FTA's 5307 Urbanized Area Formula Program, to include planning, capital, and operating activities. Operating expenses are eligible back beginning January 20th. And there's no limit on the amount of funds that agencies can use for operating expenses. Activities are funded at 100% federal share, which means there is no required state or local match, and there's no lapse date on those funds. So basically, those funds will remain available until expended. They don't expire. Locally, our urbanized area received $91 million, and those funds are split 4 ways between PSTA, HART, PCPT up in Pasco County, and T-BARTA. We've got local agencies in Manatee and Hernando County as well, and they obviously will receive some CARES Act funds, but they are in different UZAs, so they're not part of that $91 million total that we received. COVID-19 obviously will evolve over the coming weeks and months, but the transit industry's focus, no doubt, will continue to be on the safety of employees and passengers and on sustaining operations.
All right, well, thank you so much. I don't see any questions right now. We are still waiting for Commissioner Welch to be able to attend. In the meantime, why don't we move forward? Chris, Chris Steinocher, could you give us an update on what the Chamber is doing throughout all this that I am so proud of?
Well, thank you, Madam Chair. I appreciate it. Can you hear me all right?
Yes.
Oh, perfect. And you mind if I share my screen? I'd love to show you what I've been doing.
Please do.
Okay, great. Thank you very much. And good morning, everybody. I appreciate everybody's attention today. I am going to try to share my thoughts with you of what our executive committee and our board has been working on through this. Hopefully, Madam Chair, can you see my screen all right and the words on it?
Yes, yes.
All right, perfect. So I'm going to go through this very slowly. I wish this was in a better form, but first of all, I'm very proud of our executive committee who's on the call today, as well as our entire staff. Our chamber has reached out and touched every member of our Chamber of Commerce. We've had conversations with 1,140 of those members. We are tracking each one of their cases to make sure that we understand, are they open? Are they closed? Where are they at in their relief efforts? We're doing a lot of documentation and we're learning a lot about that. So this information that I'm going to show you comes from just our membership and our community partners, our EDC, our Grow Smarter effort, our greenhouse, our downtown partnership, and all the other community organizations from the Urban League and One Community and others who've helped us and help inform us. So this is a community document, I would say, Madam Chair. But what we are saying, and you all had mentioned it, and Councilwoman Gabbard offered that I was on the call yesterday. What I'd love to do is get you up to date on how we're going to reopen our community. What we're going to do first is our recommendations are health and safety first, everybody, as you've heard from quite a few of the speakers already. On the screen in front of you are the 3 gated requests from Opening Up America again. That's our national from the White House, what they've told every state to be looking out for. So these are not, these are that every state is looking at. Our symptoms, our cases in our hospitals, and they're, for the symptoms, it's a 2-part piece you can read, and for the cases, it's 2-part, and for hospitals as well. What I was pleased to hear from the mayor is his gating criteria are very similar. He offered us 4 of those, and the first 2 are on the screen right now, the percentage of positive test cases and hospital capacity. So for the business community out there, I feel like our governments are aligning with what they're telling us the data is that we need to look for. And so what our job now is to begin to really understand the data so we can get out back to work, right? So this is what we're going to try to do. So what we are saying is once we now know that we have our gating criteria for us to go back to work, we are saying 3 things about that piece of it. First is let's keep our eyes on the data. It's obviously very important and it changes every day. And some of the modeling information is important, but what we've learned from our friends and our partners in this community from Johns Hopkins, there's a lot of great data behind the models that we should be looking at for Pinellas County, and we are starting to. So we got to be the best at understanding data. You and I, as business owners, have to be able to tell our employees and our customers why or why not we are operating the way we are. So let's get good at it. The second part is imagine a world where we're going to ask people to open back up and we still have an issue with our PPE issues. First of all, 6 weeks ago, none of us knew what PPEs are. Now we're in a fight for a life form and we've got them being sewn on our kitchen tables at night. But what we're offering our county and our city to consider is some sort of source Pinellas effort where we take it under our own hands to make sure that we have our own PPEs available, not only for those frontline workers that we currently are trying to protect, that are both serving us our food at Publix, as well as those healthcare folks that are in our hospitals today, as well as now getting ready for any one of our businesses who believes that they need this equipment as well. So we, and we don't see any of that. We see a kind of a catch as catch can effort on sourcing. I think we need to get really serious about it, and it's going to be a long-term thing. I also think we need to have conversations with our medical device community, the #2 largest medical device community in the state and #3 in the country, that maybe they can assist us on this effort. And the final piece we've heard a lot about is the testing. We've only tested 1% of our population in St. Pete. That's obviously not enough to know what our trends are. I was glad we heard more, but I think we need a real strategy on how we go about testing. There are cities that have done a lot of creative efforts to make sure they have a strategy of who and how we get tested and how many tests we need, as well as the tracing. When we ask our health department right now in Pinellas County, do you have enough folks to trace? The answer is we don't know. So we got to get a good answer on how many tracers do we need. And if you watch 60 Minutes the other night, you understand what a tracer is. It's somebody that's on the phone just asking people, where were you last? Trying to really put together the map of who else might be affected. So that is before we even get to the next part, which is about what Councilwoman Gabbard asked, is how do we reopen?
Chris, if I can just interrupt for a second. I know Commissioner Ken Welch has been able to join us, and I think he's on a pretty tight time schedule given the County Commission meeting coming up in a few minutes. Do you mind if we interrupt and let him come on?
Yes, please.
Okay. Matt, Commissioner Welch, thank you so much for joining us. And we look forward to hearing your update from what the county is doing.
Well, thank you all. And I wish I could change so I could see everybody on the screen. I'm still seeing.
I'll stop sharing. Hold on.
Yes,
okay.
Thank you.
There we go.
Perfect.
All right. How is everyone doing in this new world of Zoom meetings?
Figuring it out.
Trying to maximize so I can see everybody here. There you go. Man, this is the fullest Zoom screen I've ever been on. Thank you all for being here. Chris really was hitting on a lot of the key points we just talked about in our executive policy group, which is the sheriff, the Department of Health director, our emergency management director, several others. We have an 8 o'clock call every morning, and he hit on a lot of the issues that we were talking about. Just kind of going backwards, the PPE is the critical issue. And some good news is that we have been working on local manufacturing of masks and shields, working through Mike Meidel. The real key issue right now are, of course, the N95 masks. And we do have some good news on that, just kind of a new way of thinking in decontaminating those masks instead of just using them one time. and the Pinellas Park Fire District has set up a decontamination procedure that can handle 1,800 masks a day, and that's up and running now. We also are working with Miami-Dade County, and they set up a massive decontamination process that can handle, and I believe I have the right number, 600,000 per day. And so we just have to get in the queue, get our masks shipped down there and shipped back. So we are making progress on the PPE issue. A couple of things I want to hit on quickly. You may have touched on them already, but I truly believe, and I've stated before, that the main issue is not beaches and condo pools. That's important, but really getting folks back to work, getting our non-essential, quote unquote, businesses back in operation is really the key. Folks don't have money to put food on the table. You can't get through unemployment. I think they're up to maybe 14, 15% of claims paid now. So we've got folks who haven't had income for weeks on end now. I volunteered just for a short time this weekend with Feeding Tampa Bay at the Trop, and that line of cars was 6 blocks long at 7:30 in the morning. And they're seeing folks that they've never seen before needing food assistance. So I think we really need to focus on how we get businesses back in operation. You know, our safer at home order, I think, met the right balance of allowing folks to stay in operation if they met CDC guidelines. And of course, the governor's order overruled that. We were anticipating that the governor's order would expire April 30, and we would go back to safer at home and start up a lot of those businesses. But what I'm hearing this morning, and maybe y'all are hearing something similar, is that the governor might just stay with his current order and keep that in place. So that's going to be kind of a curve for us to see what he actually does in a couple of days. We were told this morning he's headed up to the White House for a meeting today, and he'll be back this afternoon with some announcement. So we're waiting for that. I think dealing with that immediate problem, there are 2 things that we're going to approve today, and that's to help get folks immediate help. One is the CARES Act financial assistance program, and Matt, I just emailed you the 2 forms that we're going to work on today. That would basically put up to $4,000 in the pockets of families in Pinellas County. And the way it'll work, it'll pay their utility bills, their mortgage, their rent, and that would go directly to the landlord or to the utility vendor. We've already got the infrastructure set up through the county's existing financial assistance program, so we think we can get that one up and running pretty quickly. The other part of it is small business assistance, and that will be up to $5,000 for small businesses. We estimate we'll be able to help up to 6,500 businesses, and this is all from the $170 million in CARES Act funding that are coming to the county. Hopefully the next round will allow for cities to access that as well. I know the mayor's been working on that. And Matt, you've got that criteria as well. It's for small companies, 25 or less. They have to be based in Pinellas County. So we're hoping to get those dollars into the hands of small businesses in the next couple of weeks as well. And then after that, I think the reopening, exactly as Chris was laying out, we're going to follow the federal guidelines. There's some debate on whether we've had 2 weeks of declining hospitalizations. We're basically flat from where we were a couple of weeks ago. It hasn't really been declining. And we do have a real issue with our nursing homes. When you look at our data, the spikes have been nursing homes, and we have task forces working on that right now. And so I just believe the reopening needs to happen in a staged way, in an incremental way. And I think it needs to start with reopening those non-essential businesses with strict CDC guidelines, then moving to slowly reopening beaches. I think Clearwater had the best approach on that, where it would be for exercise only, and then we'll see, how folks comply with that. I'm really worried about Memorial Day. We saw what happened in Jacksonville when they opened their beaches. So that's the path that I think we'll take starting at 9:30. Madam Chair, I'm open to any questions y'all might have.
Thank you very much, Commissioner. I really do appreciate that. Looks like we've got a question so far. I'm not sure if this is in your wheelhouse, but it's regarding the ventilator interface with the person, that there's a new design that might avoid intubation that's out on the open source with 3D printers. Have you heard about anything like that for people making ventilators in our area?
I have not. If the person that has that question is available for our meeting today, that would be a great question for Dr. Cho. He will be at our meeting today. Or if you want to email me, I'll ask him that question.
Yeah, Mike, if you want to email me, I can forward that over to the commissioner and the county staff. So just let me know, Mike. Are any other questions for the commissioner? If you just type in the chat, I can highlight you pretty quickly if instead of asking your full question. Madam Chair, do you have any questions or?
Commissioner, I'll ask you the same question I asked Councilwoman Gabbard.
Okay.
One of the things that's in the back of my mind is hurricane season fast approaching. And I wondered if the commission or the county, what's going on in the back of your minds about preparing us when we're still dealing with this inevitable problem of not being able to get close to each other? How are we going to evacuate? What do you think is going to happen?
Thank you so much for that question. I don't really need to sleep at all, so thank you. We have been looking at that. Our emergency management director, Kathy Perkins, gives us an update almost daily on that. It would be the perfect storm. One of the issues is that federal guidance has come out saying that your shelter space, your square footage needs to increase because of COVID-19. Folks need to be further away from each other in the shelters, when in fact we don't have the space to do that, to even approximate that. So those are one of the things that we're looking at. We're also looking at, do we need to change our evacuation protocols? But all those things are being looked at daily, not only by our emergency management director, but by the sheriff and law enforcement as well. It'll be here very quickly.
Commissioner, we got a clarification question on the $4,000.
Okay.
Can you explain what do people have to submit their lease and their bills to the county, or how does that work?
I think in the document I sent you, it has that procedure in it.
Okay.
But they would have to provide, proof of residency, proof of the bill. I did not mention it is means tested. It pays, it supports folks up to 200% of the federal poverty level, which is about 52 grand for a family of 4. Yeah, you'd have to have that documentation, and the payments go directly to the vendor.
All right, we've got a question from Paul Carter on our board. What's the county looking at to ensure full participation in the November election or earlier the primary? And I know that Senator Brandis brought up that we are kind of in a interim supervisor elections right now. I know that blanking on her name is leaving us, and they're looking at a new one. So, what have you heard about elections in Pinellas County?
Well, I actually think we're pretty well positioned because Deb has focused so much on mail voting, which is really the way to go. So I think we're pretty well positioned. The census has been impacted as well, and that's very important. But I think we're in pretty good shape as long as we don't get a change in the way folks can vote by mail.
Gotcha. Any other questions? Oh, how is the county planning to tackle transportation financing now that we've taken the potential referendum off the table?
Yeah, COVID changed everything. I think we're now looking at 22, and what we do in the interim. We had not looked at a gas tax. That's something that might come back because our transportation trust funds are still in a deficit posture. And so that's one of the things that I know our budget folks are looking at. We don't see as much of an impact on our general fund ad valorem, but we do see a huge impact on our bed tax revenues. And so we'll get that whole budget projection in the next few weeks from OMB. But I think we might have to do something interim in terms of the gas tax because we are delaying that 1% tax at least until 22.
Gotcha. From Jason Jensen, local architect, also on our board and our vice chair of this council. Can we assist small businesses with Pinellas County purchasing directed to give a Pinellas County preference to ensure the CIP stimulus stays in Pinellas?
In terms of which bucket of dollars are we referring to.
Jason, let me find you real quick, and I'm going to go ahead and open you up to, hold on just a second, sorry. Got 100 people on the call, so it's,
That's
there
a
you
good
are. There you are, Jason.
So the question is for purchasing right now is a fairly wide multi-county preference, and it does not stipulate small businesses either. So we're just looking for contracts purchasing future CIP dollars that if we could instate a Pinellas County preference to ensure that when we're giving money to Pinellas County that it stays in Pinellas.
That's a great question, and I love your background as well there. So have you talked to any of our economic development folks? We do have an SBE program that we revitalized over the last couple of years, and it really has focused on small businesses in Pinellas County and in the Bay Area. I would like to connect you with Dr. Johnson and see if you can access that existing program. As you know, when you talk about local preference, it gets into legal technicalities of what is local and how do you define your local area. And so we've had that conversation several times, but it seems like our SBE program has found the right balance. So I'd really like to connect you with Dr. Johnson to talk about that.
All right. Any other questions for Commissioner before he has to run? Well, Commissioner, thank you so much for joining us and for all your hard work and your colleagues' work at the county level. You have last things to say before you head off and go past this thing?
No, thanks for all your work and your partnership. Brighter days are ahead, but we are dealing with an era of uncertainty. It's not like a hurricane where it's coming, it's going to pass at a certain time and you can rebuild. We're going to be dealing with this uncertainty for a while. So I just appreciate your partnership. And Matt, you promised me next time that Reverend Pritchett was going to ask me a question. I'm deeply disappointed. So,
we'll get JC on the ball better.
All right. Y'all take care.
Wait, one last question looks like real quick. Are the small business dollars available to sole proprietorships and individual businesses?
I believe so. There's some exclusions. Home-based businesses are excluded. Nonprofits are excluded. Those are all in the last page, I think, of the document that I sent you. So if you could distribute that and have folks take a look at it.
Yeah, everyone, I'm going to get that to our marketing department as soon as this meeting's over and have them put that up on our webpage, our Prepare webpage. So stpete.com/prepare. That'll be on there before the end of the morning for sure.
Okay.
Thank you so much. Really
All right. I'll take care.
Thank you so
All right.
much.
Bye-bye.
All right, well, why don't we jump back to Chris, if you can keep on with your great presentation. Thank you.
Sure. Thank you very much. That was very helpful, and I appreciate the commissioner coming on board. That getting that money on the street is very important right now. So I hope that they can get that $170 million up to us. I was about just to discuss that as well. So here's where I left off about let's get ourselves reopened.
Chris, can you go page wide on your document instead of it looks like you're at like 75% or what have you on your view? If you go to view,
Good question, Matt. I don't know the answer to that one, but we'll see.
If you go to view in the menu bar, you should be able to change it.
I'm on a different kind of computer than you guys use. I'm on a Mac, so I don't know so I'm at 100%. So is it unreadable or?
We'll just try to go page wide. So you where it says 100%, see if you can go page wide.
Thank you. No.
175%.
All right, there we go. That's really big.
150% maybe.
Is that not any better?
That's too big. Maybe 150%.
Jeez, leave me alone, will you guys? All right, I'm gonna do that. Is that good?
That's much better.
All right, thank you, Matt. Matt's very good on Zoom calls and letting people know what they're doing incorrectly. I appreciate that about Matt. He does that on our staff calls and everywhere. Do you guys have one of those on your staff who lets you know that? Because they're very helpful. They're gonna get extra pay when this is over. So thank you, Matt.
We are?
Just kidding with you, buddy. All right, so we're going with the 4 R's. This is what the Florida Chamber is working with. It came out of a McKinsey effort that McKinsey continues to build off. If you haven't been to their site to look at what the thought leaders talking about. But what we really are working on is relief, reopen, recover, reimagine. While we'd love to get to recover and reimagine, and we think we're doing it right now, we are still way in the grips of relief efforts right now. And what we have been able to do is design kind of concepts and strategy statements about each one of these. So when we can say to ourselves in the relief efforts right now, our effort is to stabilize the people and our businesses. And now we have to keep asking ourselves, what additional measures can we take to assist all these people, right? And so in these boxes below this would be all the tactics you've heard from the PPP program and the new money that just got on board, to the SBA bridge loan program, to the Fighting Chance program, to the counties program. These are all efforts, to the tip jar in St. Pete. These are all efforts, and they're still not enough. I was disappointed to hear from Ken Welch that they're not taking care of home-based businesses and solo entrepreneurs with this county money. So we've got a lot of our businesses. Imagine all those businesses you and I go at Saturday Market that we buy stuff from. They're considered home businesses. They've been left out of the relief efforts. And so a lot of our smaller St. Pete cool businesses are still needing relief, and we got to continue to work on that while we turn our heads to reopen, which is a phased effort to get people out so that we can get to a recover effort where we can start to get a return aggregate demand back to us so that we can begin to identify what have we just learned from all this and how we'll never do it again. Okay, so this is how we're going to do it. And the chamber and our community partners are going to be putting those tactics in here, just as we've talked about, that you and I are going to take advantage of and that you and I are going to be part of. Relief efforts still must go on, though. I see from this Zoom screen, I've got like a gentleman like Steve Westfall on the line. Steve is a hero. Steve has fed 10,000 meals in the last 5 weeks, Steve, is that correct? And so there's going to be more and more of that needed. So I do think that if you can contribute to the Fighting Chance Fund for St. Pete, or you can give to a business, you need to do that. We need to figure out how to do that more. But as I mentioned, if Brandi's still online, Brandi, I know we're still going to be talking about reopen this next week, but relief to me is still very important because this is going to be a slow rollout that's going to require a lot more resources that we thought we were going to need. But let's say we can get past all those gates that we just talked about earlier about what the trends start to look good, and we all agree that we've got this under control. What phase one has told us, again, are these 5 things that they've told us about. We must continue to encourage teleworking. So the Chamber of Commerce, when we go to this first round, we will still be teleworking. There is no reason for us to do anything at this point unless we feel like we can be more efficient in our offices. If I have folks in my office who have technology issues at home and feel like their office is a better place, we will discuss that. But we're going to continue to do that. And then we're going to return to work in phases. Maybe I'll open up one side of my building, but not the entire side. And then again, we've been encouraged by the federal government. We're not having break rooms. We're not having lunch times. We're not having these meetings. So everything that we're still doing is a lot of that is still what is being recommended for this phase one. So that is just a very broad interpretation. As we know, common sense tells us that you leave things to a broad interpretation, you're going to get a lot of different kind of revisions of that. So what we're asking our city to consider is thinking about this a little differently and just really begin to provide our businesses the opportunity to do it the right way, okay? Rather than use those broad guidelines, let's get into specifics. So what we have found, and I don't know if you can see this document all right, and I'll send it out to you guys. Everybody will have all this information at the end of the meeting. But what the CDC is telling us, okay, so these are the gates on the left we've just talked about, guys. These are all the health issues, and these are all the at-risk people that we're going to protect before we even reopen. Now, what I need our businesses, you on the call, to start considering are these things in the middle. We need to learn and be the best at what both OSHA and CDC are recommending to us. There is an online, I'm going to give you a link for the OSHA handbook for your business as well. You need to start learning it. You need to start really understanding. And on your next staff Zoom call tomorrow morning, start talking about what are we going to put in our recommendations for our business. Because I believe that the government at any level is really not going to tell you how to do your business because they're going to be on the hook to source some of that stuff for you. So do you think our government's really going to tell us that we're all going to have to wear masks? That's going to be a debate. but you and your business have to decide that. And you have to decide what the right or wrong answer for you is based on a careful risk analysis of your organization. Last week on the Catalyst Show, we had the folks from Lassiter Ware help us understand what a risk analysis is for your business. I would go look at that and make sure you understand what a risk analysis is, because it'll walk you through every step what you have to think about for anything from how you guys are going to use your staplers in the copy room to how you're going to talk to a customer if they come to your office and you think they might look sick, right? So those are all upon you. So we've been really sitting here the last 6 weeks going, holy cow, what's going on? What's the government going to do for me? Now what we have to do is kind of go, holy cow, what are we going to do to prove to the government that we have all these figured out? And what I'm asking us to do is start assembling in groups to do that. So our restaurateurs can create a pretty nice little social policy for how they feel like they're going to work. And maybe best practices can come out of that we can share with City Council and County Commission to say, hey, our restaurateurs have already met. Here's what they've come up with for these 2 boxes. And they know how they're treating their operations, and they know what kind of policies they're going to create through this process. Let's review those with you so you guys allow us to open up. So I think our opportunity, Madam Chair, is on our behaviors going forward today. We now know what the gates are. We can't do anything about this. We can learn about it. We can invest in testing for our businesses and for our community, but we can't change that except for staying distant. What we can change in our behaviors today is preparing for the opportunity to open up right now. What we're also being told is, please know that whatever policies you're making, you may have to tell your employees, if it spikes up in 2 weeks, we all go back. And so what happens to all these policies? What happens to all the things you purchased? You have to think through the bad case scenario, which is being told you to put in your policy of returning. So you've got a lot of work to do on this effort. What I've been told by the economists at the Florida Chamber, and I really believe them, they're the only state chamber that has the pedigree that they have on staff. If we do this correctly, and if we roll out in Florida the way the Florida Chamber, the governor wants to roll out, we have one chance to get it right. If we get it right, we can actually start seeing some returns to our GDP by the first quarter of 2021. So we can actually get back to work next year and have maybe, on a best case scenario, have lost about 2.8% of our GDP. Now that sounds like a lot. That was as much as we've lost in 2007, 2008. But in the Great Depression, our GDP went down by about 35%. So if we do this right, we can have a 2% hit. If we do not do this correctly, and you and I have to go back after a month of doing this and we go back into isolation, the economists predict it's a 2024 recovery for us. So we have one chance. So why I ask all of us to be very cautious about rushing out is because rushing out may actually hurt us even more financially. So please, let's get this part right. So I'm asking all of our businesses, the chamber is going to have a town hall explaining this, and then we're going to ask our businesses to get together in peer groups if they care to help each other come up with their best thinking on this. I would love to be able to present that to our City Council and County Commission in future meetings so that they know what we're looking at. Okay. So as I've mentioned before, there's a guide from OSHA. If you get on their publication site, they have a guide just for COVID safe opening for your business. I encourage you to look at that and read it. And then you're going to need a lot more detail because it doesn't give specific to each kind of operation in a restaurant. It just gives you some specifics. And so we ask you guys to get associated with that. The final piece is we also have just done something different. So our chamber, you can imagine, hey, you guys pay me to do this job. So many of you have, and thank you very much. Many of you have not, and I understand why, and I haven't asked you for it. We're not dropping any members right now. I'm going to hold on to everybody. We're going to defer anybody's membership. I hope that you can pay so that I can keep my job, but we're going to do what we can right now. But what we have done is taken most of our staff and put them in the field, working in the greenhouse, working what we call business navigator teams. The thing we're noticing most of all is how many businesses really need somebody to walk them through what I'm walking you through today, from how have you gotten your relief efforts? Let's go through the checklist. And how are you preparing for your restart efforts? Let's go through the checklist. We're needing to do a lot of counseling and guiding. So we've taken 5 of our staff, Matt included, and he spends half of his time just working with any business on making sure that they have all the opportunities they can be to win. We're the only city that I'm aware of that's invested in this reopening in this way. And that was your Chamber of Commerce investing in it with the Grow Smarter team from the Florida Foundation for a Healthy St. Pete invested in that. So now what we have is the ability to help you, but you've got to help yourself. You've got to get these documents in front of you and start working on it, and our resource team can assist you with that. The final piece we're playing with the county is to talk about how, when you reopen, you may want to start talking about, you heard the commissioner talking about playing smarter, like how do you open the beaches is one issue, but how do you bring these operation plans, these specific operational plans to fruition is another piece. So I think there's ways that we can separate some of the conversations if work groups are being needed in the county or city efforts. So that's the, I'll quickly just say, then we'll get to the recovery efforts where we need to start then marketing ourselves. So what we're asking, like Visit St. Pete, Florida, Visit St. Pete, Clearwater, any of our people, we're really not marketing our community right now because we don't want visitors. Visitors right now would really mess with us. And that is a hard thing to say right now because that's from whence I came, but we have to be careful. So we can't do our marketing campaigns till we've got this all figured out and all of our phases are open again. Then we can start in the recovery efforts to get everybody's demand back to where it needs to be. And then finally, you and I will have a cold beverage somewhere, and we will begin to talk about what did we learn from this? What changes, policies are my business is going to make or my community going to make so that we're going to be a better community from this? That's going to be a welcomed activity, hopefully down the line. I know we're doing a lot of reimagining now. So I don't know, I went very long, but I also, one of the questions we're getting is about just the liability for your business on this. Hey, I open up and I get someone sick, am I liable? Senator Brandis is on the line, and I think he wanted to mention a little bit about that. Senator, are you still on that?
Yeah, I'm here.
Perfect.
So no, obviously it's one major issue that we're thinking about is small businesses are one lawsuit away from closing, and the trial bar is already conducting seminars on how to sue for COVID related issues. And so I think it's one of the things that I proposed a piece of legislation. We're working on a draft of that right now. We've been talking to our partners, both at the state chamber and at the U.S. Chamber of Commerce, about how we can best protect small businesses in general on the liability front, create a safe harbor so that if you're complying with state guidelines, you're going to have a safe harbor for liability. We're looking to explore whether the governor has that power under his emergency powers. Some governors do, for example, in Michigan and New York, they have that power. So we've been talking to his legal team about that. But I think it's important that we address this issue of liability. And so, before you kind of turn the lights back on, make sure, one, you're checking with your current insurance company. We know, for example, under business interruption insurance, viruses generally aren't covered under business interruption insurance. That's a major issue that's out there right now and probably subject to many lawsuits around the country, class action suits, things of that nature. That businesses are struggling to kind of navigate and negotiate with their insurers on business interruption. But this broader concept of general liability insurance, when somebody does ultimately go into your businesses and get sick from somebody standing too close to the air conditioner and it sucked the virus in the air conditioner, and all of a sudden you got 10 people infected. Those are real scenarios that can happen, and we want to make sure that your small business isn't unduly impacted by some liability concerns when you're trying to do everything you can to comply with the law, and all of a sudden something happens that can basically shut down your business and force a lawsuit that could cripple you for years or frankly put you out of business. So we're working with the U.S. Chamber, the state chamber, and with a number of firms throughout the state on that issue, specifically as it relates to businesses we told couldn't shut down. For example, if you're a Publix or a Winn-Dixie, we told you we can't, you're essential. Same with our nursing homes and our ALFs. They are essential businesses that must operate, and yet they are some of the most affected by COVID because they have some of the worst outcomes just because of the nature of the population by which they work with. So we've got to address this issue of liability. There is some discussion of this happening at the national level. In the U.S. Senate, as part of a negotiation for the next stimulus package that goes out, there is a discussion about kind of blanket COVID liability protection. So that's happening both at the state level now with my legislation and nationally. And there was a big Wall Street Journal editorial on this on Thursday or Friday of last week that covered this issue because it is such an important issue for small businesses to think about is this liability issue.
Beautiful. Great. Well, I appreciate your leadership on that. And I didn't get a chance to, but I also appreciate your leadership on this session and the announcements you've made about the things that we have to look forward to after this when we get back to work. Both at courthouse and our school and our downtown is going to be a beautiful thing. Can I ask you one other question? The painting behind you is haunting to me. What is this? What is that behind me? What is that?
Here, I'll show you my little collection here. I got it kind of up here. So I collected artist named Vladimir Kush who lives in Hawaii. I went over to Hawaii a few years ago and started buying his pieces and now have a number of his pieces. So yeah, my wife won't let me set them up anywhere but this room. So it's the gallery view of
It kind of reminds me of the night gallery.
That one's called Nero. So
okay.
Yeah.
I love it. All right, Senator, thank you for your help on that. Madam Chair, I'm finished with that part of the presentation. If anyone has any questions or comments or thoughts about what kind of recommendations I can give our mayor when I meet with him on Thursday about the opening and the county city council on Thursday when I speak to them and the county commission as well. So anything you didn't hear that I'm should be discussing, please, this is what I need from you guys is any input about ways or thoughts about opening.
Chris, one of the questions that's coming up is just accessibility to your presentation, to your documents and information.
Yeah. How about if I ask Matt to, when I finalize it, I will send it out to everybody on this call as well as then we'll post it and send it out to everybody else. But I'll make sure everybody on the call has it.
Okay.
Great.
Does anybody else have any questions? Okay.
Oh, but can I ask one question? Because I did hear the concern from the commissioner about our senior facilities. And on the line, we do have Maddie, I think is still on the line, who runs one of those and also runs our Leadership Tampa Bay efforts. Maddie, are you still on the line? And do you have any insights about just the state of affairs for the senior care facilities? Did she drop?
I think she may have dropped, Chris.
Okay. I'm curious about that one because we got to get that under control as well, just so that we can have a safe opening. But I was just curious about that because at one point we felt like that wasn't being communicated correctly. But I want to see if we really do have hotspots or not. Because the real bottom line is, guys, we've got 1% of our Pinellas is tracking low numbers of percent of positive cases, but we just don't have enough tests done yet to be that confident. So if we can get some more tests done and let these next 2 weeks go through, I think we'll know then if we're ready to go.
All right. Well, thank you so much, Chris.
Yes, ma'am.
While we're all here together, even though things are been moving in a slightly different path than we normally would, we would like to give a chance for our committees to give an update. Brooks Wallington with the Transportation Committee. Did you have any update that you'd like to provide on things that are where we're going?
Yeah, hey guys, how you doing? Thanks. Not too much an update. We heard from regional partners last month. Sounds like without the tax going through, we're having to change our strategy quite a bit. The regional partners expressed that they basically just focused on essential work at this point. A little bit of good news. Some of the projects are able to move up and be done a little bit quicker than the original timelines. We've decided that because the transportation tax isn't going to happen now for a couple of years, that really I think we have to take a different approach to how we're imagining transportation. So we're going to have our next meeting moderated by a professional moderator. Topher Morrison has agreed to moderate our next meeting, and it's basically going to be a brainstorming session on how we can reimagine transportation here in the area, knowing that we're not going to have the funds that we had been planning on having here for the last several months. So other than that, the brainstorming session is going to be next month, and I hope everybody on the call today can get on that call so we can hear your ideas about how to move forward with transportation. That's it.
Thanks,
All
Brooks.
right, thank you. Chair Jay Miller with Housing Land Use. Do you have any update for us?
Well, the two issues that we've been discussing over the last 6 months in our committee are the proposed changes to the codes for coastal development in the coastal high hazard area. My understanding, that's the first. My understanding is that council has decided to delay consideration of their proposed change to the code until such time as they can have in-person meetings again in order to facilitate public comment. The second is the discussion of linkage fees to provide a source of revenue for affordable housing. That's a proposal that our committee formally opposed. My understanding about linkage fees is that they've been tabled for now until we get through this crisis at a minimum. If Councilmember Gabbard is still on the call and has any further comments, or if I've said anything that's incorrect, I would welcome her updates and comments on these two issues.
Well, thank you, Jay. Yes, I'm still here. And no, I think you summarized it pretty well. Coastal high hazard, that is an issue that while we are looking at continuing to move it forward, it is important that we be able to get the feedback and public comment that we know a very controversial issue like that will bring forward. So yes, we are looking at postponing that until we can get back to in-person meetings. If that delays too long, we may reevaluate that. But, as of right now, that's where we stand on that. Linkage fees. So that was pretty quickly after all of this started to happen. That was a conversation that I had with Rob Gertis, just to talk about, well, is that still on the table? Where are we at with that? And very, very quickly, I think that administration realized that in such a large economic uncertainty and downturn, the last thing that we should be doing is looking at increasing fees on anyone for anything. While our affordable housing initiatives are just as important as they always have been, putting that on the developers at this time really seems very irresponsible. And so, it's no surprise that, I wasn't a big fan of it in the first place. I did not vote at the committee of the whole to move it forward to full council. But as of now, it looks like administration is realizing that this is not the right time to be doing that. So, yeah, that's kind of where we are.
Thank you, Brandi.
All right, thank you so much, Jay. And Councilwoman Gabbard, thank you. Legislative Committee, Albie Kaminsky, I think I saw that you were here. Would you be willing to give an update if you have one?
Thank you, Madam Chair. And who better to give a legislative update than members of the legislature, right?
Mm-hmm.
No, in all seriousness, thank you, Senator Brandis and Councilmember Gabbard and Commissioner Welch earlier. Again, I think they addressed pretty much everything here. We did have a quick conversation. Jason set this up with some of the members of the Tampa Bay Chamber with the legislative committee over there, just kind of addressing it from a regional perspective too, of what people are doing over here on this side of the bay and what they're doing over there, and a lot of great efforts all around. And I think we're heading in the right direction.
Great, thank you. And Brandi Gabbard, she just left a note that the council's legislative committee is meeting on May 14th. All right. Do we have any other questions or comments for the good of the order? If not, I'll pass it back to Matt for any recap he'd like to give on what the chamber is doing.
Thank you, Madam Chair. No, this was just great information. There's really not anything to add, other than I did talk briefly with Chris Spencer, who is the governor's chief policy advisor and former chairman of our legislative committee, and he just kind of reassured me that they expect to have some regulations rolled out by the end of this week. It's going to be a slow roll, just as the senator mentioned and Commissioner Welch did. But I think that we're going to start seeing things reopen soon. And as long as everyone takes it seriously, doesn't just rush in and start filling places, and as long as we don't see another spike, we'll be able to see more and more things reopening and rolling out. So I just want to let everyone know like how great a friend Chris Spencer has been to the St. Pete Chamber throughout this entire operation. He definitely gets a Burger of the Year award from me for sure. So I just want to let everyone know that. But does anyone have any questions for myself before we kick off here? Let's see anything.
Hey, Matt.
Sir.
Yeah, the only thing I would say to the folks is first, make sure everybody has looked at the chat before they get off, because there's some great information available. There's some great stories in there as well. But what I've heard a lot of folks just concerned about being represented on the opening task forces that are being created. And all I would say is, if you really have, I understand it, because there are folks that aren't represented on there, but I will do my best. So if you have any needs that you want to express that are, anything that would help your business reopen, please let me represent you on that at that meeting, and I'll document it and put it out there for everybody. So I just want to make sure that our businesses are all represented. And then the question that Brandi had is, if you do know of any businesses, so we've opened up our navigating services to any member or any business. You don't have to be a member. Maybe in an ideal world, they'll remember that we help them, and when they get strong again, they'll become members. But right now, any business who needs help, please have them contact kvogel@stpete.com, and they'll get in our navigating team. We're adding navigators every day as well. So I just think part of this is we've got to be patient with each other and help each other however we can. And I appreciate what I'm seeing, and I'm looking forward to more of it. So thank you.
And Matt and Ann, if I may, just to kind of piggyback on what Chris just said, I had seen several of the comments as well about not feeling represented in the group of advisors, and I've been making a list of those issues, and I had already kind of been getting some people reaching out feeling as though maybe they weren't being represented. So if anybody does have any other concerns, not only get them to Chris, as he is a great representation for all of you, but please feel free to reach out to my office and share that information as well. We want to make sure that all voices are represented. That's hard to do in a small group, but you've got council, you've got Chris, so please know that my door is open and you can reach out to me with all those concerns as well, and I will share them.
Wonderful.
Great, thank you.
Just quick housekeeping. I'm going to go ahead and leave this open for a few minutes so you guys can scroll that chat and see what Chris was talking about, and getting any emails or other links that you need to pull from there. I'm going to go ahead and end the recording, but we're going to try and get this up through some channel so y'all can, if anyone came in late, or I know that we had some issues of being at capacity, which I do apologize for. I thought I had more capacity, so we'll have that fixed certainly by next month. But if you all have any questions, I'm putting my email in the chat as well, so you guys can reach out to me. But with that, Madam Chair, I am all done.
All right, great. And if you notice, there's like some buttons by the chat, little 3 dots. You can save the chat to your desktop. So if you want to just save all the information there. Thank you all for joining us this morning. Thank you to all our local representatives who were so generous with their time to tell us about what's going on. Wishing everybody well as we continue to move through this crisis, and we'll be in touch. Thank you so much.
Thank you.